dear friend. I'm Dr. Manoj Baid from Eureka Hospital in Indore. I'm an orthopedic surgeon and I'm doing joint replacement surgery also. Here we are talking about osteoporosis. Osteoporosis is a disease of bone where it weakens your bone and it makes your bone thinner and less dense than they should be at your age. And ultimately, it leads to fracture. Most people don't know that they are having osteoporosis until it causes fracture or it causes more bone pain. Actually, it is a more seen above 50 years of the age. uh, for the men of chronic disease, and more in female due to some menopausal problem or some hormonal causes. Most of the time, hip bones, wrist bone, and spines are more affected with this osteoporosis. Approximately 50 million people in US are affected, and it is said that one out of four people, one out of four men above age of 50 are affected with osteoporosis. If we talk about symptoms, bony pain is the most commonly seen, and then any sudden breakage of the bone with a small trauma or minor trauma. And another symptom is when your colleague, when your relative says that your height is reduced. So reduction of the height, change of posture, shortness of breath, and low backache are the main symptoms when it leads to fracture if you are having osteoporosis. Actually, bone contain constantly replace their cells. Above 50 years of age, bone replaces their cell and produce less cells, so it causes bone density low in your body. In menopausal woman, loose bones loses their more cells, so it causes more osteoporosis. And if we talk about risk factors, age is the most commonly biggest risk factor above 50 years of age. In another commonly seen in a female where menopause, if it occurs early in the age, if you are having thinner and smaller frame of the people, smaller frame, your body posture is small, smoking habits, tobacco habits, if you are having some endocrine disease, if you are having pregnancy, because pregnancy also, pregnant women also having osteoporosis. Sometimes if you are having some GI disturbances like IBS, like celiac diseases, if you are having rheumatoid arthritis, ankylosing spondylitis, if you are taking corticosteroid for longer period of time for some other diseases, for some other treatment of the disease, you can very well, you are prone to osteoporosis, in particularly if you are taking steroids. If you are taking hormonal therapy, if you are having some cancer and taking some hormone therapy, that also leads to osteoporosis, and then ultimately causes bony pain or fractures later on. If we talk about diagnosis, how we can go for diagnosis and what are the lab tests. So when you go for some fractures and you get X-ray done, then you suddenly see that your bone is not very good, your bone is very thin. So like X-ray, then another tool is BMD, then some blood test, calcium test, thyroid test, and lastly DEXA scan. DEXA scan is a scan where X-ray is taken, and with your age it compare that your normal people is having this much bone density, and what is your age, what is your density of the bone. So by these methods you can diagnose osteoporosis in early, and you can treat accordingly your patient. If we talk about treatment, in my view, treatment is exercise is very important. If you are bedridden patient, if you are low profile patient, low profile people, your your office boy, you are not exposed to sun, then exercise is very important. All muscle exercises, bony exercises, joint exercises, it makes you fit and it makes your bones stronger. Sun exposure is very important. When you sit longer period of time in air conditioner compartment, then it may sometimes your body doesn't absorb vitamin D, and then ultimately leads to deficiency of calcium also. Then we can give vitamins and vitamin D also. We can give supplements also. We can give some medication also available in the market this time. What we call it anti-osteoporotic treatment, like bisphosphonate, PTH, like denosumab. So, but mostly it is very important that you prevent your disease. You can prevent your disease, osteoporosis, by doing some life changes and avoid some bad habits like tobacco and smoking. So it is little brief, but we can go. We are more expecting anti-osteoporotic treatment in future world. So at this moment, this is the basic idea of osteoporosis.